Hello and welcome back. Well, today I am really thrilled to be able to have a conversation today about, and this is probably the first time that I think that we've talked specifically about emerging leaders. And I want to start really, I think, by clarifying a couple of things about it, because I know when we talk about leadership, often when we hear the word emerging leader, we assume that we're talking about somebody who is young, potentially inexperienced, or is new to what they're doing. And that's often because even if you looked up the definition of the word emerging, one of the examples that you'll see given is you're called something like an emerging artist or an established artist. So, for the most part, people, when I'm talking to them about emerging leaders, they assume we're immediately going to talk about those people who are quite young. But that's not what, in fact, we're talking about. So, in leadership, there are a number of ways that you can influence leadership. In a company, you might be assigned a leader, so you've been put into a position. You could be delegated into a leadership position, and you may have a formal position. But an emerging leader is somebody who doesn't necessarily need a title or a formal position to be somebody who's having an impact in the world. So my preference is more of the lengthier definition of emerging, which goes a little bit like this. So to emerge is to be newly created. So it's about the creation of something. It's about growing in strength and popularity and becoming widely known. Now, you can probably hear that an emerging leader may be somebody who's been around for quite a while, is experienced. In fact, I even would say myself, I would call myself an emerging leader. But I also think on a day-to-day basis, if you're an established leader, the challenges that we have to deal with on a daily basis in today's environment, when you consider that 90% of the population are considered not resilient, when you consider the health challenges that we're facing, and when you consider the modern day way of life, when we're showing up to work, dealing with the rapid growth of technology, to actually be a leader in any moment while dealing with those challenges is an active process of really stopping, doing the thinking, and looking at what's wanted or needed to emerge in a way that aligns with your passion, with your values, and with your purpose. So with that in mind, today I am really delighted to be able to have a very special guest, somebody that is dear to my heart after last year winning the Emerging Leaders Award in the health category with Women's Agenda. And the introduction I'm going to have to give you at length, given her background and academic qualifications, so I can give you a full appreciation for who this woman really is. But when we met, I happened to be a judge on the awards and was just in awe of Manasi's commitment and work that she's doing in the space, especially with First Nations people, but a passion really to having people thrive and living a meaningful life by understanding things like the role of culture and our belief systems in the experience and coping of pain. So today you got with me Dr. Manasi, and I really do hope, Manasi, I am going to pronounce the full name correctly, Mittinty, who is a physician scientist at Flinders University. She's an MD, a PhD in medicine, an advanced global clinical scholar research fellow with Harvard Medical School. And she's a recipient of some incredible prestigious awards, including the 2023 finalist Australian Stellar South Asian Women Award, the Harvard Mobility Grant Award in 2023. As I mentioned, the Women's Agenda Emerging a Leader in Health category last year, and the Australian Government funded Endeavour Postdoctoral Fellowship Award. I mean, Manasi, where do we even begin? Oh, I mean, it's just remarkable. So thank you firstly for joining me today, and I really do want to start by saying congratulations on all the acknowledgements and the that you're receiving as a result of the work that you're passionate about, and the work that you're doing. So why don't we say hi, and why don't we start with you sharing a little bit about the work that you're doing and what is it that you're so passionate about?
Sure. Thank you, Kylie, for having me. This is such a such an honor to be on the podcast and have this chat with you. We have, of course, spoken briefly over the years about my work, but it's a real treat to sit down and have this conversation. So I think in a nutshell, if I have to elaborate on what I do, I think I am trying to understand how and why each one of us experiences pain differently. Now, coming from a very scientific background, I am trained to question everything. And so naturally, when I started my PhD, I was very intrigued to understand how we are looking at pain care, especially for people who English is not their first language. So it was a natural gravitation towards understanding what we are doing for First Nations people, but also what we are doing for CAL communities in that space. So that is really, in nutshell, what I'm trying to achieve. And like you very rightfully captured, that culture and belief is such a strong influence, and how we process not only life, but also how we look at health, how we look at well-being, how we cope with certain things. So it's really a very, very important factor that needs to be looked at. And that's what my work tries to achieve. And on the other side, I'm also trying to develop patient-centered programs with the emphasis that we not only look at the individual, but we look at how the chronic pain is affecting their relationships, their family functioning, their mental health. Because I think this is a package. If we look at things in silo, we are doing disservice to the other presentations. And so I think the goal is to look at it as a whole.
Mm. Oh my goodness. So, as you know, obviously, I am Indigenous as well. So, certainly fall into the area that you're talking about. And I couldn't help but think, whilst you were talking about that, about, being a part of that myself, and having been through many things where I've experienced pain, chronic pain, autoimmune condition, and was very, I'd have to say, very unaware of the role of culture on health issues. And then I've heard, or whilst I've heard the term intergenerational trauma used, I've been very ignorant about really how does that work? I mean, can you potentially shed any light on some of that for us?
Sure. No, I think that's a very interesting element of what we observed in the research that we have done, in particular to the intergenerational trauma. So, to explain it in a very simplified manner, when we looked at First Nations people, what we saw that they had early exposure to family members who had experienced chronic pain forever. So there was no point in time where they could recollect that they have never heard about it. So there was this kind of acceptance that this is a part of life and I am going to get it. So there was that acceptance. So naturally, through the conversation, what I kind of alluded to is, do you want to be pain free? And to my surprise, the answer was yes. So they recognize that pain is very much a part of my existence, but I also want to be pain free. And what the study participants kind of shared with me was that by being pain free, it was going to allow them to be more present in their life, whereas it was now bringing them down, now kind of affecting how they conducted themselves into day-to-day activities. And this is interesting from clinical perspective for a very key reason is that, say, for example, a Caucasian male breaks his arm and is in an ER. They are going to look at that injury as an acute injury and treat it likewise. Fair enough, because that's the protocol that we have in medical care. If there is a First Nations individual who's injured their arm and is seen at an acute care, there is quite strong likelihood that that's not an acute presentation. They are living with chronic pain before that. So you got to then look at their management with those lenses as well. And I think this is something that really needed to be, publicized and needed to be shared. So I think that's the key difference. Also, I think a lot of the participants that I saw shared that they had a living member in the family who was coping with chronic pain and had stories of how going down the pharmacological management had not really helped them, but actually worsened it in some form. So there was this hesitance that I really don't get it, that if I share this, it's really going to make a meaningful change. So I think that's very key. And one of the things that really stands out for me is that there's work in this space, but we are looking at um, adapting existing scales to, say, language or cultural habits. But we are never asking the question that do these scales actually capture your pain experience? And that's the element my research brought in. That before I went down this trajectory of adapting scales, the first rational thought for me was to understand the questions that I pose, do they speak to you? Do they capture your experience? And it did. So I think that's where I think we need to do more work. And I do want to be very uh, mindful of the fact that I saw only a small proportion of individuals from South Australia here in Adelaide. So it might not be generic and apply everywhere in Australia, but that remains to be, research that remains to be studied.
So part of your plan is to continue the research?
Yes.
Right.
Yes, of course. Yeah.
Yeah,
Yeah.
great. So can I ask you a little bit more about the definition of pain?
Sure.
I mean, I was left curious about, especially the example that you used between the gentleman that came in with the injury, he was Caucasian, but the assumption on the other one with the different pain in the background. So what constitutes pain?
So that is a very interesting question. I don't remember the exact wording, but the revised definition that came out in 2020 recognized two things. One, that every individual will experience the pain in their biopsychosocial context, which means that even in experimental setting, if I was to zap someone with same voltage, it's likely that two people from different ethnic backgrounds or different life circumstances are going to report it differently. And that's because it's not actually the experiment that's causing them pain or the process of processing of pain, but it's their own biopsychosocial context. And the second thing that the definition did was that it validated that even when someone is not in the capacity to articulate the pain in the way that we expect them to, that does not negate that they're experiencing severe pain. So I think that revised definition has broadened how we look at chronic pain. But when we look at First Nations people in particular, what our research showed is that they experience pain in the context of biopsychosocial and spiritual. And that's because it's very ingrained in their connection to land, in the history of colonization, in the connection to the lost generation. And so these narratives or these stories are passed down from generation. So it's very important that when we look at pain for this community, we address these elements as well.
Wow, that is extraordinary. I mean, one thing that so much, but the part that you were saying about the instrument and the two different people will have a different reaction, say, or level of pain. which therefore, as you suggested, it has nothing to do with the instrument, but it's to do with the human being themselves, which brings up the issues of cultural background, belief systems, and then you alluded to the difference and the uniqueness of the First Nations background. I mean, that is remarkable.
Yeah, it really surprised me as well. And I want to share a personal experience here. So at the age of 15, I was in a fire accident and I got burned 85%, severe degree burns, was in hospital, ICU for many months, and then in rehab. But up until I think 2015, I always looked at that experience as something that had happened to my parents because I could see their faces. They were distraught, and there was this fear that they were going to lose me. And so in my mind, I was just thinking, I need to get back. I need to get back. I can't see them like that. And they are, in a great turmoil. So all my energies were focused on, I'm fine, I'm fine. I'm going to walk again. I'm going to go back to school again. And I went on to do what I did with my career and my schooling is because I was motivated to keep them happy. Law in 2015, I was living in this community where there was a domestic violence on a neighbor, and there was a fire, and I could smell burned hair. I was doing my PhD then, knew all the research. One would think that I could cope better, but I got so scared that I couldn't go back home. Nobody was harmed. It resolved really well, touch wood for that, but it scarred me so badly that I couldn't get back home. The moment I would arrive near the gate, I just couldn't bring myself to go in, open the door, sit there. And I had this really sort of panicky feeling and anxiety around it. So I went in to see a therapist and I spoke about it. And that's when I realized that there was an element of it that I was holding on to, which I had no clue to. Like till date, if you ask me today, I think that accident is one of the best experiences of my life because at that young age, it gave me so much power and reflection that it changed who I became as an adult. And I'm very grateful for that experience. But in 2015, there was some element in my memory that just triggered that reaction. So I think that speaks to how you experience pain. It's just in the context in which you relate with it, in the context in which you assess it, and the narrative around it is what will influence mostly how you then cope with it.
Mm.
One of the key factors, yeah.
Gosh, I'm lost for words. I can see the parallel. I mean that design almost as a human being, and the influence that it has, uh, and in every area. I mean, whilst you were pointing to the instrument, for example, in health,
Yes.
um, test case. I mean, if we're talking about in the context of life and leadership, for example, or even being at work,
Mm.
the instrument we could say is another human being. And if another
Yes.
human being says certain things, what one person might be able to hear, or somebody says, go and see your boss, for example, two people will hear that message completely different based on the different cultural belief systems, experiences, and if that person's had a bad experience with getting sent to the teacher's office before. But it's the same in life, right? Like the way in which we're responding, not just physicality wise, but because that reaction, as you well know, is also a painful experience. Someone says something and they may think it's funny, but you're like, well, that ain't funny to me. In fact, I'm
Yeah.
immediately triggered into a concern of trust and betrayal. I mean, it's
Yeah.
just a can of worms.
It is. Yes. Yeah, I agree because I think uh, one thing that I strongly have learned through this process of working in chronic pain is that it's more about taking preventive measures. Um, Unfortunately, we do not have, you know, management that takes away the chronic pain. but the hope and the aim is to empower people to, live with it or exist with it in a meaningful way. I do so in most days, I would say, but there are days when nothing works. And then you've got to be true to that as well, that there are going to be moments where everything's just downhill, and that's fine, because that then makes the uphill process even more enjoyable. But I think the goal for me is to see that we take some preventive measures, because there's so much of research that shows that chronic pain is here to stay. The stats are really bad. We see that 1 in 4 Australians live with chronic pain. So, what that means is either each one of us or our loved one will be living with it. So, it's a problem that we have to somehow learn to adapt with and yet live and thrive with it.
Mm. Can I just come back to that for a second?
Yes.
It's kind of almost following back up on the conversation we started having about the definition of pain. So when you talk about then chronic pain and the 1 in 4 who will live with chronic pain, what are some of the examples that like what does that look like? Like what are the symptoms, or what does chronic pain look like?
So, there are many forms of chronic pain. We have a very nice narrative to it, which is primary chronic pain and secondary chronic pain. So for Australia, I think low back pain, or globally, low back pain or arthritis, osteoarthritis, rheumatoid arthritis are some of the pressing issues. Um, and it's in general, like, it can present as a symptom on its own. So for me, for example, I have carried nerve pain through my accident, and it has stayed with me all my life. And so there are good days and there are bad days. But then someone might have an injury that might lead to some form of pain, or you might have osteoarthritis and that might come with chronic pain. So it varies. It can come as a primary condition on its own, or it could be accompanying an existing diagnosis.
Right. So, okay, that's fantastic. So I can hear that simple things like lower back pain or back pain,
Yeah.
which is chronic for a lot of people, especially, last week we had on a guest, Lizzie Williamson, who was talking about movement, 2 minutes of movement, because of the sedentary way in which we work today, where we're not moving as much, which can present all kinds of problems. And so I'm immediately thinking, whilst on the surface we go, well, that's only 20%. Probably would guarantee it a bet that a lot of people probably live with chronic pain, such as the issues like back pain or neck pain or even migraines, for example,
Yes. Sure.
right? Like
Yeah.
my son complains of migraines a lot. I mean, he's had, poor kid, he's had 4 concussions, right?
Oh.
Not all from football, but some from football. But as a result, he complains of he's had migraines a lot.
Mm.
So I think I just like the idea of being able to see how it looks in life, because I think it could be easy for us to say, oh, chronic pain, yeah, I don't get that, that's somebody else. But the reality is, I think a lot of people on a day-to-day basis have some kind of ailment that would be considered chronic.
Yeah, absolutely. And I think where I kind of look at it is that whenever you see a healthcare provider in whatever capacity, at the most you're seeing them from 10 to 30 minutes. But then you have a family member who's usually involved in how the management strategies are planned. We are very big in literature actually to involving significant others to come on board and discuss the strategies and to trial and test what works for the family, what doesn't. So I see them as a really wonderful asset. And if we go beyond, slightly beyond just a companion in the patient's management, to how would they function in sync and support each other live with this condition,
That's so
that
great.
would be, yeah, because I think within 30 minutes, with all good intentions, you do get just the surface of it. But a partner or a parent or even a friend, whoever is closer to you sees you in the full breadth of it.
Mm.
And so they are trying to support you. But when you create a narrative that the patient has a power to influence the partner's health as well, that also shifts the narrative that, okay, you are also in a position to give them more well-being, or be supportive and help each other navigate this. So that's the kind of work that I was doing in my postdoctoral work, which is looking at dyadic coping. So the term sounds fancy, but in reality, it just means that two people who share this intimate bond, how do they cope with each other when in chronic pain? Do they affect each other's mental health? Do they affect each other's relationship? Because interestingly, dyadic coping is a term that says that the partner is not supporting the patient just to get them through the disease, but also to keep their relationship intact. So the relationship is the key sort of outcome that they are more focused on. How do I protect my marriage? How do I protect my loved one relationship, affection? So that's, I think, if we bring that into the narrative for medical health, I think that would be very empowering, because patients sometimes um, do not get this message enough, that you are also in a power to influence your loved one's life. I
Mhm.
think that can be really empowering, to look at it as it's a give and take. They
Mm.
are going to support you, how you're going to support them. So there's an exchange.
That's so important. I mean, I've been watching the Robbie Williams documentary of late on Netflix. I watched it the other day,
Yeah.
and there was a point when he was, it was basically the way in which it was done. He was looking back on his life, and they showed the video footage of all the stuff that he'd done over the years. And it got to the point where they were showing the time in his life when he had hit rock bottom, and he went through a lot of physical pain, and he described the physical pain like anxiety, and he just wasn't present. And it was as though his mind had shut down from so much anxiety based on all the publicity that had come out in the press. But when he eventually stopped, he put himself into rehab.
Mm.
And when we think about rehab, right, so for people who are obviously suffering, that's a chronic issue that's got him to that point, right? And obviously addiction and being at a point where you need to go to rehab is a perfect example. But when you think about it, well, that's why rehab works, is because you're in an environment where you're not having to rely on yourself to get yourself better. You're actually relying on those around you. And I share that, because I think the value of what you're saying about the importance of relationships and of our communication with each other, on how we nurture each other, the decisions that we make on a daily basis about what we decide to do with our health, can have a significant impact on
Mm.
people being well.
Yeah, I agree. And that is so interesting. I haven't seen that documentary, but what brought to my mind was that I did a study with UCLH London Hospital. They have a pain clinic. And so they wanted to understand, what are the patients' view about the clinic? Is it helping them? What can they do better? So we decided as a group that we are going to take an innovative approach and give the patients an A4 size paper on arrival and say, write a letter to your friend, either recommending or not recommending the clinic anonymously. And there was a box somewhere in the clinic, you put it there. Now, what we were expecting was, we were expecting to hear comments like, oh, the treatment's not good, or, this could be improved, or very logical. But what instead we found, and this is published, we found was that simple things, that there was a clinic that recognized my pain. I was not going to be judged when I walked in, right from the reception to the healthcare providers to the whole staff knew what chronic pain is and were committed to help, made a huge difference. Yes, the healthcare providers were excellent, but the extended staff, not just the provider, but the whole nursing and the reception staff, were extremely warm and welcoming, made a great difference. And lastly, while patients were leaving, ready to go, the receptionist would offer them, oh, would you like a cup of tea and biscuit? Now, this is done in UK, Caucasian population. For them, the tea and biscuit meant so much, that she was so kind, they were so warm. I sat down, I had a cup of tea, I had my biscuits. And so that surprised us, because we were thinking with really scientific logical hat that, okay, they're going to say this bring this treatment, or I have heard about this, why don't you get this? But we got none of that. We got more about relationships. We got more about being welcome. We got more about being treated well. And just, I'm looking forward to coming to the clinic is the message we got,
Oh,
which is
so
so
great.
important. Yeah.
So great. I mean, what immediately comes to mind is obviously what we're dealing with in the world at the moment is really difficult, with what's happening in the Middle East. And, I saw a video recently of a woman who had lost her son, who disappeared in the middle of the night. And so far, she hasn't found him and they haven't found a body. And it's really heartbreaking. And on her video in particular, her message is to respond with love, not with hate. And I think that just speaks volumes to what you're saying about, sometimes it's hard, it can be hard to stop and interrupt our own natural reaction to want to be angry at something, but when you're in an environment providing love, love can alter anything.
Mm.
And I just couldn't help but think that the importance of that in life, not just with obviously chronic health and health conditions, but to get us through no matter what one's dealing with, as a way to live a more productive, thriving, fulfilled, passionate life, right?
Yeah, no, I agree. And to be hearing that message from someone in that circumstances is very powerful. I haven't seen the video,
Oh, very
but I think
powerful.
it just, yeah, speaks volume to the capacity in which human beings are functioning is just amazing.
Yeah, well, I think it also, given the work that you're doing specifically around the community of First Nations people and the challenges that they face, on many fronts, in particular the health side of things, it seems. I guess it just brings up a question for me. In fact, I know some of the work that you're doing, you also talk about looking at strategies and solutions. So, what is it that you think, or what are seeing is wanted and needed in order to help?
Mm, gosh, that is such a big question. But I think if I had to break it down, I would think take away preventative lens to dealing with chronic pain. And what we are seeing increasingly is that chronic pain and mental health go hand in hand, because sometimes you cannot see mental health, you cannot see chronic pain, and sometimes people feel stigmatized and vilified for living with these conditions. And sadly, we don't have a cure yet. So I think taking the lens of prevention is key here in bigger scheme. But on a day-to-day basis, I think good amount of sleep, some amount of sunshine, getting some exercise. And when we say exercise, usually people think working out. No, not working out per se, but increasing your daily activity scale by even a few seconds. Staying out in nature, taking moments to just shut down and just close your eyes and take a few breaths is really key. And I can honestly say that that's very hard said than done. I live by that. But when you can, make it a priority too, because then it somehow will help you navigate the challenging days. So I think very, and what has worked for me living with chronic pain, I think, is not multitasking. There was a period in my career or my life where I wanted to take on everything. And that was just a very wrong decision. And I think the more I have disengaged from doing more to doing less and being in contentment, that has really shifted my health. That do less, but be content with what you're doing. Show the same amount of compassion you show others towards yourself. I think that really helps.
I love that. Oh my goodness. That's a nice little way to, it's nice, great way to end on some really great takeaways, I think, from today's conversation. But before we do wrap up, I want to ask you, you're really, I just want to, as you may have heard, we talked a bit at the beginning about, certainly the area that's really happened to become into the foreground for me over the last, 12 months in particular, is to narrow down the work that I'm doing in leadership, specifically to emerging. And I'm just, in awe, I suppose, when we look at the things that show up for people in emerging leadership. We are really talking about a really deep connection to some kind of passion someone has, and a real driven to fulfill on a particular purpose. And when you've got those two things, you will do anything. You will be resilient against a lot of stuff. And I want to acknowledge that, because I know for people looking to really want to make an impact and be a leader outside of the traditional, potentially patriarchal, manufacturing based model of business, we're looking for, how does one be a leader and have an impact in the world when you don't have the access to potential resources, or you don't have the access to being in a formal position. And so, whilst I don't know if it was clear for everybody when we first joined the call, I'm pretty sure I want to just acknowledge the work that you're doing and the impact you're having as somebody who's been able to, have your own lived experience and a very strong passion, but a real purpose to really use this research to influence change in a particular area. And you're somebody who's in a research role in a university doing what you can to do to make this work. And so a couple of things I want to talk about. Well, one thing I want to talk about, but I just want to make a call out to any of our guests in particular here. Obviously in the industry, there is so many opportunities, I believe, given First Nations health. So whether you're someone who works in that space, and is looking for somebody who carries the expertise that Manasi certainly has, and you could benefit from that, you should definitely reach out to her and try to have a conversation about how she can potentially, give advice or whatever. And or, I don't know, if you're building some platform or some way that this kind of information can get spread more broadly to impact health conditions, please also reach out to Manasi. But to you, Manasi, I do want to acknowledge you, because I think it was that you, in one of our previous conversations, please correct me if I'm wrong, you have 4 degrees. Yes, I know you're laughing. We didn't quite catch at the beginning of the laugh and the audio when I when I asked you that. But I mean, absolutely remarkable, the determination and what you've done to get where you are.
Thank you. I appreciate that. But I think I also want to acknowledge that, success or whatever little I have garnered is not my own to celebrate. I have always had people who have supported me, like my Harvard degree. My husband was the reason that I did apply. A mentor of mine suggested I should go for it. I did not, because I thought it was Harvard, and he nagged me to death to apply. And I thought, let me apply. They're going to reject me, and that's it. Then I can say it's done. They accepted me. And so, really people at different stages in my life have seen something bigger in me and pushed me, which I'm very, very grateful for. There have been moments when I look back and I feel like I would have never thought that this is what I would be doing with my life in point in time. But I'm surprised at the way the journey has changed its flow and found, cheerleaders and champions to support. And I think that's what I try to bring in my role that I go everywhere is people are quite nervous about recognizing others' leadership. So these are very it is looked upon in a scary format that, okay, someone else gets ahead, then they are the ones who are seen and appreciated or funded. But actually there's enough to go around. There should not be There should not be a space of holding back from appreciating someone's work. And this is what I try to bring into my roles, is working with teams who feel heard, who feel validated, but who also feel appreciated for their inputs and what they bring to the table. Thank you so much for having this platform and creating this dialogue, because not a lot of people see the hardships. They usually see the posters of, the nominations or the winning, but they do not see the backlash and the rejections that have gone before that. So this is an excellent platform for that. Thank you.
Oh, you're so welcome, and thank you. And I would like to ask. I mean, what is the best way that, if for any reason, someone would like to connect with you to learn more about what you're doing, and certainly the benefit or impact, and certainly at least in our country worldwide, what is the best way for them to connect with you?
Oh, definitely reach out to me on LinkedIn, or my email address is here in the podcast. Reach out to me. We can have a chat about it and brainstorm really what works. Because I think there is a real scope to support each other's goals as well. That's I think one of the challenges, and I think we spoke about it a little bit in our earlier conversation, is that opportunities do come, but they come as a tick box. So you're taken in, given a seat at the table. What next? There's no plan for organizations to take these people and do something with them. And I think there's good intentions there, but there still needs to be more opportunities to work synergistically. I am all about supporting your goals and my goals to grow together. So I'm really interested in like-minded people connecting.
That's fantastic. An extraordinary way to finish our conversation today. So, thank you so much for making the time available to share your wisdom and your courage, and just really excited to be seeing what happens next in the work that you're doing.
Oh, thank you so much, Kylie. Really appreciate your time and efforts into putting this together. Thank you so much.